Any difficulty in study? Don't panic. Dental anatomy is here. Today we discussed about the oral anatomy. So today topic is or chapter is Introduction to Oral Anatomy. Overview. Oral anatomy is the study of structure related to oral cavity. What is the oral cavity? Oral cavity is commonly referred to as the mouth, and oral cavity and the face or the face. The oral cavity is composed of variety structures which play a vital role in essential physiological activity such as speech, mastication, deglutition. The hard tissue unit of the oral cavity includes bones, examples mainly maxilla, mandible, and other facial bones, and most importantly, very important, tooth and its supporting alveolar process. The soft tissue unit of our oral cavity include tongue, palate, lips, gingiva, cheeks, salivary gland. Now go to the definition of oral anatomy. Anatomy is Greek word. Ana means apart or separate. Tome means to cut open or to cut apart. So the anatomy is a branch of biology and medicine that deal with structures of living things, any living things. Knowledge of anatomy is basic for understanding the other basic science such as physiology, microbiology, and pathology, as well as applied science such as medicine and surgery. Oral anatomy is the study of structures related to oral cavity. Oral cavity is commonly referred to as the mouth. The oral cavity and or the face. Oral anatomy is the foundation for sound dental education, speech, and its practice. This chapter means introduction to oral anatomy chapter aims at providing the necessary explanation to help understand the fundamental terminology and structural unit associated with oral anatomy. Next to introduction to oral anatomy, the oral cavity, commonly referred to as mouth. We know that about the mouth. It is also called the buccal cavity. It is most frequently used a part of the human body and perform many functions which are vital function and essential function for existence of our body. Being the origin of alimentary canal that receive food. Its primary function is related to processing and digestion of food. Examples are receive any foods and go to the its food go to the mouth, and it's mixing with saliva and masticating and formation of the food bolus, etc. And the secondary functions are those associated with speech, respiration, aesthetics, and facial expression. Facial expression means happy, sad, angry. A dentist field of work is oral cavity, which necessitates a throughout the understanding of the oral structures for effective care of patients. Significance of oral anatomy. With the ever expanding frontiers of medicine, the necessity of the super specialization has attained paramount priority. Gone are the days when a single physician took care of all the problems of a patient. Today there is a remarkable improvement in the quality of patient care and treatment with a more focused management of disease processes, which of growth of subspecialties and super specialization, subspecialization and super specialization. There is a addition a definitive needs for target oriented and focus literature with the emphasize the regional management of disease process. Dentistry on its own can be considered as a specialized branch of health science, focusing on the management of disease of the teeth, oral cavity, and periodontal structures. Periodontal structures mean around the mouth. A very important component in the fundamentals of dental education is oral anatomy. Oral anatomy forms the basic understanding the structures and the functions of components consisting oral anatomy, oral cavity, face, head, neck. In-depth knowledge of the oral and periodontal structures, their relationship with the adjacent structures, and the relevant nomenclatures is essential for the some following reason. Those are to identify, study normal structures and form, to recognize abnormalities, to understand disease processes by the correlating abnormalities with normal structures. to lay a foundation for the study and practice of pathology, to aid diagnosis and treatment of disease processes, and to plan and perform surgical procedure. The study of the oral cavity can never be complete without the knowledge of the perineal structures, as the functioning of the one anatomical unit depends on its interaction with the neighboring units and in the body as a whole. The oral cavity has a direct structures as well as direct and indirect functional relationship with the surrounding structures, including the brain, which maintain learning about the surrounding structures too. Thus, oral cavity broadly encompasses two major components. Those are oral cavity and perineal structures. Perineal structures include the face, head and neck. Now go to the organization of the oral cavity. The human body in totally or in parts. Essential consist of an outer integumentary system of skin or mucous membrane, which contains the inner structure. Those inner components divide into different structures. Those are, one is Bisra. First, Bisra. Bisra are the internal organ that perform specific functions. Second, skeletal system. It is the composed of bones and joint which provide the structural framework for the form and function of the body. Third is muscular system. Muscular system consists of components which position and coordinate movement of the skeletal system and the viscera. Nervous system. Nervous system consists of a network of nerves which help in integration, coordination and functioning of all other systems by the transmission of electric impulse from the brain and spinal cord. Vascular system. Fifth is the vascular system. Vascular system consists of artery and veins which help in the supply and drainage of blood respectively to and the from the tissue and viscera. Sixth is lymphatic system. Lymphatic system are structures that play a role in locoregional defense of the human body through a network of lymphatic channel and collection center called lymph node. So the description of above mentioned components to head and neck are discuss elaborately in the individual chapters. Those are coming soon. Boundary of the oral cavity. What is the boundary of the oral cavity? The extent of oral cavity is demarcated by the following landmarks: hard and soft palate superficially, and tongue and floor of the mouth inferiorly, superiorly and inferiorly. Superiorly, hard and soft palate; inferiorly, the tongue and floor of mouth. Anterior and lateral boundary are formed by lips, upper teeth and lower teeth, while the palatoglossal folds on either side mark the posterior limiting point. The oral cavity is unique in first that it has a totally moist environment and is lined by mucosal membrane. That means mucosal membrane is specialized membrane. Division of the oral cavity. The oral cavity is an almost oval shaped cavity which is two basic components. One are vestibule and others are oral cavity proper. Vestibule, oral cavity proper. Vestibule বা vestibulum oris is the space bounded by the lips and cheeks on exterior and gums and teeth within. It is lined by mucous membrane which is kept most by the secretion received from salivary gland. This mucous membrane is consist with the mucous lining of lips, cheeks and alveolars of upper and lower jaws. The vestibule communicates with the exterior of the body through the orifice of the mouth or the oral sphincter. Oral sphincter, also called rhima, and with the oral cavity proper on either side through the narrow space behind the wisdom teeth when the mouth is closed. Oral cavity proper or cavum oris proprium. Oral cavity proper or cavum oris proprium. It is the area confined with the upper and lower dental arch. When the mouth is closed, the oral cavity proper is surrounded on all sides by the alveoli carrying the teeth. It communicates with the pharynx through a narrow inlet called the isthmus of the faces or the oropharyngeal isthmus. Its roof is formed by the hard tissue and soft palate, hard and soft palate, and the floor is by tongue and oral mucosal membrane lining the floor of mouth. Now go to the alphabet or basic terminology of oral anatomy. It is also common in human anatomy. The following terminology is the important to understand and the simplify the description of individual anatomical structures of the oral cavity as well as their relationship with the adjacent organ. The terminology is clinically useful in describing the extent of any lesion in case sheet, surgical procedure, or communicating with professionals. First is the superficial, intermediate, and deep. Superficial means structure close to the surface. That is the skin or oral mucosa membrane. It is the close to the surface. Intermediate means structures in between superficial and deep. Deep means structures located such below the surface at the greater depth. Second is the medial and lateral. Medial means towards the midline or towards the middle of the dental arch. Or lateral means towards the sides or towards the cheeks. For example, in clavicle bone there is a two ends. One is the sternal end and others is the acromial end. So sternal end towards the midline, that's why sternal end is the medial, and acromial end at the lateral side, that's why that is the lateral end. Third is internal and external. Internal denotes the inner aspect and external denotes the outer aspect. 4. Anterior and posterior. Anterior means towards the front of the mouth and posterior means towards the back of the mouth. Proximal is two types, mesial and distal. The terms is commonly used in the relation to dentition. The proximal surface of the teeth may be either mesial or distal. Proximal or mesial. Proximal or mesial means towards the midline of the arch, and distal means away from the midline of dental arch. When used in a context not related to the dentition, proximal referred to the region closer to trunk, while the distal referred to a part which is away from the trunk. For example, condyle of mandible is the proximal part of mandible, while symphysial region is the distal part. Next is dorsal and ventral. Dorsal is referred to the surface on the back or upper surface of an organ. It also indicates the surface of facing away from the ground. Ventral Ventral refers to the surface on the front or lower surface of an organ. It also indicates the surface facing toward the ground. Ipsilateral and contralateral. Ipsilateral denote on related to the same side. For example, right arm is ipsilateral to right leg, and left arm is ipsilateral to left leg. Contralateral, it denotes the opposite side. For example, right arm is contralateral to left leg, and left arm to contralateral to right leg. Inferior and superior. Inferior denotes the lower, and superior denotes the upper. Quadrants is more important in dental studies. A quadrant is an anatomical segment formed by division of the maxillary or mandibular arch by a imaginary midline. It's divide arch into left half and a right half. The resulting 4 quadrants are named as 4 quadrant. First one is maxillary right quadrant, maxillary left quadrant, mandibular right quadrant, and mandibular left quadrant. Maxillary 2 quadrant and mandibular 2 quadrant. Next, occlusion. Occlusion is the relationship of the teeth of mandibular. Mandibular means lower jaw, and maxillary upper jaw arch at the rest or during various movements of mandible. Occlusion. Surfaces. The surface of the various structures in the oral cavity are named based on the anatomical units nearby. First one is buccal surface. Buccal surface that face the cheeks. Buccal surface. Labial surface that face the lips. Lips is labial surface. Both are included under facial surface. Lingual surface is that face lies or closer to tongue. Or palatal surface that the face or lies closer to palate. Palatal surface, closer to tongue, lingual surface. Anatomical planes, those are reference planes used to study deeper structure and their relationship with the adjacent anatomical unit. They are two-dimensional representation of three-dimensional structures and are obtained by dissection in cadavers and imaging techniques in living subjects. The various planes as follows. Median, plane that divide into right and left half. Which plane divides the body into right and left halves? That is called the median plane. Sagittal plane that divide the body parts of the body into the right and left unequal part. Sagittal unequal part, that means there is a right and left sagittal. Coronal plane is the divide the body parts of body into the anterior and posterior part. Divide into left half, right half, median. Right or left unequal part, sagittal. Body is plane divides into anterior, posterior, coronal. Transverse or horizontal planes that divide into body part of the body into the upper and lower. Upper and lower divides transverse or horizontal planes. Axial. Axial, any cut or plane at right angle to the body or long axis. Any plane. Next topics is the components of the oral cavity. The oral cavity and the perineal structures can be grouped into two major components: hard tissue, soft tissue. Hard tissue, skeletal unit means bones, and dental unit means teeth. Soft tissue, tongue, cheeks, soft palate, left salivary gland, and various other organs. Hard tissue. The hard tissue consisting the oral cavity and the perineal structures fall under the following two categories: perineal bones and dentition. Perineal bones, those are include maxilla, mandible, and other bone of skull. First one is mandible. Mandible refer to the lower jaw. It is the movable sturdy bone that articulates with the rest of the skull by the joint on either side called the temporomandibular joint. Maxilla. Maxilla is referred to the upper jaw. Unlike the mandible, it is immovable. It acts like a cushion to shield the cranium from stress due to the sudden trauma. Skull bone include bones of the facial skeleton and the cranium. Referred skull bones are detailed discussed in the next chapter. Alveolar bone by alveolus process. This is the part of maxilla and mandible that support the teeth. Dentition. The term dentition refers to the natural teeth in the jaw bones whose function is to aid in digestion by the breaking down ingested food to smaller fragments, which can be acted upon by digestive enzyme in the stomach. Dentition is three types: primary dentition, permanent dentition, and mixed dentition. Primary dentition. Primary dentition is the first set of teeth that erupt into the oral cavity. They are 20 in number and are also referred to as baby teeth or deciduous teeth. Permanent dentition. Permanent dentition refers to second set of succedaneous teeth that erupt after shedding of primary dentition. They are 32 in number and are also called secondary or adult teeth. Third one is mixed dentition. Mixed dentitions occurs when both primary and permanent teeth are present, usually between the age of 6 and 12 years. The teeth vary in their shape, size, and location in the jaw. The function of the teeth vary according to their morphology. First one is incisor. Incisor are the front single-rooted teeth with the relatively sharp, thin edge designed to cut food. They are 4 in number in each arch, towards central, front of teeth, and toward lateral, distal to central. There is incisor is for cutting. Next are the canine. Canines are corner teeth. They are also known as cuspid and are 2 in number, designed for cutting and tearing foods. Premolars are also called bicuspid. They have cusps. Bicuspid mean 2 cusps. 2 cusps that hold and the grind food in every arch. There are 4 premolar in permanent dentition, but there are no premolar in primary dentition. Molar and larger teeth with more cusps than other teeth and are used to chew or grind food. In each arch, there are 4 molars in primary dentition and 6 molar in permanent dentition. Morphology of the every tooth in both jaw is unique and numbered. This is the discuss in details in topic chapters are tooth morphology. Soft tissue. The soft tissue of oral cavity draped the skeletal components. They are composed of the lips, cheeks, gum, tongue, salivary gland, and soft palate. Lips. Labia oris. Lips are 2 fleshy linear structure, upper and lower, which encircle the orifice of mouth and control the opening and closing of oral cavity. They are composed of orbicularis oris muscle, blood vessels, nerves, alveolar tissue, fat, and numerous minor salivary gland. They are covered externally by the skin and internally by the mucous membrane. The inner surface of each lips is connected to corresponding gum by a fold of mucosa membrane in the midline called frenum. Lips play an important role in deglutition and speech. Next one is salivary gland. Salivary gland are organs that secrete saliva, which has a major role in various vital physiological functions. 3 large pairs of salivary glands communicates with the mouth. Pores their secretion into it and are the responsible for maintaining the oral cavity moist. They are parotid gland, submandibular gland, and sublingual salivary gland. In addition, there are numerous minor salivary glands. 3 is tongue. Lingua. Tongue is a special sensory organ situated in the floor of the mouth within the body of the mandible, containing very small papillae that hold the taste bud. It is firmly anchored to the floor of the mouth by a fold of mucous membrane called lingual frenum. It is the primary organ that helps in perceiving taste sensation and is also important for speech, mastication, and deglutition of food. Cheeks, bakka. Cheeks are sheet-like structures that form the side of the face and merge with the lips anteriorly. They are composed of muscle fiber, fat, alveolar tissue, blood vessels, and nerves, and are lined by the skin externally and the mucosal membrane internally. 5.1 is the gums or gingiva. Gingiva are tissue that cover the alveolar process and encircle the necks of teeth. They are composed of dense fibers tissue and adherent to the periosteum of the alveolar process. They are covered by a firm mucous membrane. Gingiva extend at fine papillae into the interdental regions, forming a healthy collar for the teeth and help is supporting them. Palate, palatum. Palate is the anatomical unit that form the roof of the mouth. It is consist of two subunits, hard palate anteriorly and soft palate posteriorly. Hard palate. Hard palate is the bony vault of the oral cavity, bounded in front and side by the alveolar arch. It is the continuous with the soft palate located behind it. It is covered by a firm lining formed by the adherence of the mucous membrane to palatal periosteum and contained a few corrugation called rugae. Its help in the physical separation of the mouth from the nasal cavity and provide separate passages for intake of air and food. Soft palate. Soft palate is a movable soft tissue suspended from the posterior border of the hard palate and forms an incomplete barrier between the mouth and the pharynx. It is the composed of mucous membrane overlying muscle fiber, palatine aponeurosis, blood vessels and nerves. It is also contained mucous gland with its substance. The soft palate has a concave ventral surface and a convex dorsal surface which merge with the lining of the nasal cavities. Its anterior border is attached to the posterior aspect of hard palate, while the lower border is free. The side of soft palate blend with the pharyngeal wall. Along the posterior free end is a small midline conical process called palatine alveolar. Two curved folds of mucous membrane originated bilaterally from the base of the alveolar, and they are called the facial pillars or arches. Subdivision of anatomy. Anatomy can be broadly classified into macroscopic anatomy, microscopic anatomy. Macroscopic anatomy can further be divided into gross anatomy and surface anatomy, while microscopic anatomy can divide into cytology and histology. Macroscopic anatomy. Macroscopic anatomy is the study of structures that can be seen by naked eye. It encompasses the following: gross anatomy. Gross anatomy. Gross anatomy is the study of the form or structures of the body part as seen the naked eye or unaided vision. This can be done system-wise: vascular anatomy, neuroanatomy, osteology, or region-wise: head and neck, upper limb. Surface anatomy or superficial anatomy. Surface anatomy is a study of external surface of the body without dissection. It helps the identifying the inner configuration of anatomical structures with the aid of visible external landmark. Microscopic anatomy. Microscopic anatomy is the study of structures in minute detail with microscopy. It consists of the following: cytology, study of cell; histology, study of tissue. This is also include the more specialized method such as histochemistry and immunocytochemistry, in which biochemical techniques are combined with histology. One part is a applied anatomy. Applied anatomy is the study of the form and the structures of different anatomical units as applied to diagnosis and treatments. It includes the following: clinical anatomy, surgical anatomy, and radiological anatomy. What is the clinical anatomy? Clinical anatomy is the practical application of the anatomy in diagnosis and treatment planning. Surgical anatomy. Surgical anatomy is the anatomy that facilitated planning and performing surgical procedure. Radiological anatomy. Radiological anatomy is the study of anatomy in living subject by interpretation of the structures in radiographs and scan. The evolution of the field of anatomy has led to creation of other specialized branch such as developmental anatomy, embryology, and comparative anatomy, comparative study of anatomy in different species. Approaches to studying anatomy. The mode of studying anatomy are more than being confined to books. They have widened scope with the use of clinical material in the form of cadaver, live subject, imaging method, and microscopy. Today, anatomy is learned through diverse and the novel approaches mentioned as follows. Dissectional. This includes the traditional study of gross anatomy of deeper structures, which the aid of scalpel dissection of the cadavers and study during the surgical dissection in the living subject. Clinical. Clinical is the study of anatomy practically in the living subject by inspection and palpation. It correlate clinical features with anatomical structures and help in application of anatomy to diagnosis and treatment of patient. Radiological. Radiological consists of a structures study in the living subject through real-time notes such as ultrasound and cross-sectional notes such as CT scan and MRI scan, microscopic. This is the primarily and in vitro specialization, which involve the study of cells and tissue of specimen obtained from the human body through microscopy. Implications of oral anatomy in dentistry. Dentistry is a specialized branch of health science dealing with the care and well-being of the teeth and the oral cavity. The study of oral anatomy has numerous implications in dentistry, highlighting as follows. Establishing harmony between anatomical parts and dentistry. A dentist has the crucial role of restoring the form, function, and aesthetics of oral anatomy, oral cavity, and face, which are the totally dependent on the achieving the ideal oral anatomy. Understanding the functional importance of the oral cavity. The realm of the dentist is not only the teeth, it includes complex functions such as speech, respiration, and facial expression, which are influenced by the structures in his or her domain. A change in anatomy and dynamics of the oral cavity has a direct influence on the above mentioned function. For example, a denture extending into the soft palate not only can affect mastication, which the primary function for its fabrication, but may also significantly alter speech. A deficiency or abnormality in the jaws may affect a very important function such as respiration by creating an obstruction in the pharyngeal inlet. Third one is diagnosing disease processes. Knowledge of regional anatomy helps us to distinguish the abnormal from the normal, such as identification of lingual thyroid or a symphylatic gamma. It provides us with an understanding of the channel and notes for spread of disease process from the mouth to the body and vice versa, such as the occurrence of cavernous sinus thrombosis secondary to perineal infections. Planning and performing treatment procedures. Anatomical knowledge play an important role in the planning and execution of surgical procedure in a precise manner. 5 is the maintaining oral care and restoration and the rehabilitation of oral structures, which is the primary role of dentist. Require good working knowledge of the regional anatomy. Anatomy enable better application of biochemical principle for an effective aesthetic and the functional outcome. End of the chapter. Some few points are here. Those key points are: oral anatomy is a study of structure related of oral cavity. Oral cavity is the commonly referred to as mouth. The basic component of any anatomical unit are viscera, skeleton, muscle, nerve, blood vessel, lymphatic system. The major parts of the oral cavity include the vestibule and oral cavity proper. Anatomical plans are reference plans used to study deeper structures and their relationship with the adjacent anatomical unit. The various planes are sagittal, coronal, transverse, horizontal, and axial. Anatomy can be broadly classified into macroscopic anatomy and microscopic anatomy. Macroscopic anatomy can further be subdivided into gross anatomy and surface anatomy, while microscopic anatomy include cytology and histology. Applied anatomy is the study of the form and structures of different anatomical units as applied to diagnosis and treatment. It may be surgical, clinical, or radiological. Alternation in anatomy leads to be abnormalities in form and function of organ which clinically present as disease. The study of such disease is called pathology. Thank you.